The numbers are staggering. There are more lung cancer deaths in the United States than breast cancer, colon cancer, and prostate cancer combined. The problem is that most lung cancers are caught so late in stage 3 or 4 because it can be so difficult for radiologists to detect. But AI is being studied at university hospitals to see if it can help patients catch it much earlier. Jen Pachano shows us how it works in this 19 Health Alert.
We needed a way to find a lung cancer early. It's like finding a needle in a haystack, and that's where AI comes in.
Lung cancer nodules in their early stages can be nearly impossible for radiologists to see. Usually, lung cancer goes undiagnosed until patients start feeling symptoms.
When they are having cough, chest pain, or blood coming out of the sputum, unfortunately, that stage is stage 3 or 4. And at that time, the survival rate is whatever you do is in single digits.
Radiologist Dr. Gupta and his team at university hospitals are now conducting a study using AI to see if they can get to it sooner.
In my initial experience, it can find some of the nodules which are super hidden. And on a busy day, even a trained cardiothoracic radiologist may overlook them.
Qure.ai acts as another set of eyes in the room for radiologists. Dr. Shah, the chief medical officer, says its AI algorithm was trained on large amounts of data gathered over 9 years studying tuberculosis x-rays.
Those x-rays could be used not only to look at TB, but we started looking at lung nodules as well. And we looked at 5 million of those. That's more than I would ever read, and maybe tenfold more than I would ever read in my entire lifetime.
Through this vast amount of data, it learned what was and what wasn't a nodule. Dr. Shah says they're hopeful this application could result in a stage shift, catching lung cancer in stage 1 or 2 and boosting survival rates to 60 or 70%.
When it starts small and has not spread and it can be removed, you're talking about a curative situation, which makes patients happy, but that's what the goal is for every oncologist. That's what the goal is for every thoracic surgeon who's involved, every pulmonologist. That's what the aim is.
Qure.ai tackled lung cancer first because of the difficulty of detection, but they say this technology is also incredibly positive for attacking other equally hard illnesses like breast cancer. Jen Pachano, 19 News.
And the UH radiology team on this study expects data collection to continue for at least another 9 months. And if UH does move forward, it would be implemented in a little over a year.